Welcome to Health Chat, presented by Phoenixville Hospital. We are here today with Dr. Haupt and Dr. Martella. They are cardiothoracic surgeons. Doctors, now there's a dedicated OR for heart procedures. Now, how does this compare to some other hospitals in the area, or even those that might be in Center City?
Well, the program in cardiothoracic surgery at Phoenixville opened in 2003. And at that time, there were 2 operating rooms dedicated strictly for cardiothoracic surgery, so that there was also an operating team. And we only performed cardiac and thoracic surgery cases for the patients in this area. Prior to that, all those types of cases were sent downtown.
So is this unusual for a community hospital to have a OR dedicated for
Certainly
heart?
having a dedicated team allows us to do most cardiac and lung cases right here at Phoenixville Hospital. And that would include now robotic procedures.
Now, I understand that there's an affiliation with the University of Pennsylvania. Now, what does this mean to the patients of this area?
Well, it actually allows us to bring university-level type of care to the patients in a community hospital in their own backyard. We are faculty members at the University of Pennsylvania. We do go down there every week and present our cases, or we go over our cases. So we do have a strong affiliation at Penn.
What are some of the common procedures or operations that will take place in the OR?
Well, we're doing a number of procedures, both in cardiac and thoracic. Probably the most common cardiac procedure that we're doing is bypass procedures. In addition to that, we're doing both valve procedures and lung procedures.
So are there any other major medical developments that have taken place recently that would benefit the people who live in this area?
Well, there are a number of things that we're doing now here at Phoenixville Hospital. One of those is the use of the robot for our procedures. It allows us to do a number of them with a minimally invasive approach. Allows us to avoid breaking the breastbone, and I think it quickens the recovery both here in the hospital as well as once they get home.
Now, since you're Penn physicians, does this mean that patients no longer have to go down to the hospitals in Center City to get heart procedures done?
That's true. For the vast majority of cardiac cases, they do not have to go downtown. And also lung surgery cases. Most of those cases can all be done here at Phoenixville.
So that's a great advantage for being a community hospital then, right?
Absolutely. Offering this level of care in their own backyard, a few minutes from home. It's much easier for them to recover. It's easier for them to get a hold of a doctor. And we offer the individualized care. And we're on call 24 hours a day.
Okay, well, thank you very much, doctors. This has been Health Chat, presented by Phoenixville Hospital.